The United Nations Declaration on the Rights of Indigenous People, UNDRIP, tells us what Indigenous peoples' rights are and how they can be protected. Sometimes, though, it is hard to see how UNDRIP works. In the past, Canadian health services have discriminated against and mistreated Indigenous people. From the residential school system to segregated hospitals and instances of abuse, Indigenous people have not had access to the care they need or to care that was free of racism and exploitation. UNDRIP states that Indigenous people have a right to the highest standard of mental and physical health possible. It says Indigenous people have a right to traditional medicines and health practices, to access all social and health services, to develop and determine their own health programs, and to implement these programs through their own organizations. Governments that are implementing UNDRIP must look at how their programs and services are falling short and make changes to improve them. For example, cultural safety training for all healthcare workers. This is one way of raising the standard of healthcare for Indigenous people. So this is how UNDRIP works. It shows us the standard of life that every Indigenous person should enjoy and how we can get there. In health, this means making changes that are informed by Indigenous decision-making and culture to create health systems that are culturally safe, relevant, and can meet the specific needs of Indigenous people. This is just one example of how UNDRIP protects Indigenous rights. What are the others you can find?